Very pleased to have back in the studio with us Charles Sauer, economist, president with the conservative think tank, the Market Institute. Libertarian think tank, right?
Libertarian, economist, good policy.
Good policy, okay. Marketinstitute.org is the website, and you can tweet Charles at either his personal tweet, which is Charles Sauer, S-A-U-E-R, or at Market Institute, right?
Yep.
Okay. So, I came across this graph over at politics.work.com, which is just this incredible source of data. And it's life expectancy by state. And what you find is that the best life expectancies, with the single exception of Utah, which put into place something very much like Obamacare about 10, 12 years ago, where they've got health exchanges, the very best are all blue states: New York, Hawaii. This is 81.5 years. New York, Hawaii, Minnesota, California, Connecticut, Massachusetts, Vermont, New Hampshire, New Jersey, Colorado, Wisconsin, and Rhode Island. And then the states that have the shortest life expectancies, the very worst is Mississippi, then West Virginia, which I guess, West Virginia is a largely white state. That kind of takes it, because people will say, oh, it's African Americans who are suffering from decades or centuries of oppression, and so this is not about race. This is, I think, it's about politics. Alabama, I mean, they all have average lifespan of around 75 years, as opposed to 81 and a half for the blue states. Louisiana, Oklahoma, Kentucky, Arkansas, Tennessee, South Carolina, Georgia, Missouri, Indiana, and North Carolina. None of them have a life expectancy better than 77.8 years. Whereas the worst life expectancy among these blue states is roughly 80 years, 79.9 years. So, Charles, what, as an economist, what would account for the fact that blue states, the people in blue states, live longer? Not to mention, they're happier and healthier, and they can smoke pot, but...
Rich people live longer. I mean, it makes sense. We have rich people on the East and West Coast that are living longer. If we look even deeper into it, though, it is politics. We see that the fact that the left likes the mortgage interest deduction. We see that the mortgage deduction takes money from the states that you mentioned in the Midwest and moves them out to the coasts, where there is higher property values and a higher cost of living. And so, I think more than 50% of the people in Nancy Pelosi's district use the mortgage interest deduction. The average benefit from that deduction is $50,000, as compared to one place that I looked at in the Midwest, the average benefit was $10,000. It means that they get a 5 times benefit from this liberal policy that's just holding them down.
I think you're absolutely right, Charles. Yeah. Rich people do live longer. And the thing I find really interesting, Arkansas is one of the worst states in the union.
Yep.
Red state.
Yep.
Arkansas, I'm assuming that the Walton family still has a connection to Arkansas. And if so, I mean, just the 5 heirs of the Walton fortune have more wealth than the bottom 40% of America. Just those 5 people, which makes Arkansas one of the richest states in the country if you include the Walton, fortune. So, doesn't that kind of blow up your argument? I mean,
no, you have 5 people.
What's happening in all these red states is you have Republican policies that keep poor people poor, and that make it even harder for poor people to live because they don't expand Medicaid.
That makes absolutely zero economic sense. The policies that keep people poor are the policies of the welfare state. When you increase a welfare program, what you do is you increase the marginal tax rate. And so that's the nerdy way of saying it actually costs a lot of money to get off of welfare. And that's the problem. The left policies make it easier for rich people to stay rich and to keep the poor poor.
Welfare is a canard, Charles. The percentage of people who are living on what you're referring to as welfare in any of these states is relatively low. It's mostly people who are taking low-wage jobs. They're working for minimum wage, and in all these red states, the minimum wage is typically around $7.25 or certainly less than $8 an hour. Whereas in all these blue states, in fact, I think I can confidently say in all these blue states, the minimum wage is probably at least $9 or $10 an hour. Well, so this is policy. We're talking policy.
If you don't pay attention, it's economics. If you don't pay attention to the numbers, it's very easy to use that. Double the minimum wage and you get a better outcome. That's just not true. As I just pointed out, the mortgage interest deduction is greater or better or a bigger benefit for the people in Nancy Pelosi's district because their land values are higher, of course, and the cost of living is higher. Because the cost of living is lower in the Midwest. You don't need as much money to survive. I'm from Kansas originally.
Then why don't people live as long?
I'm from Kansas originally, and when you fly into Kansas, you'll see there's more shopping centers, more strip malls there, and that's because people actually make some pretty good money in Kansas, but the cost of living is still lower. So they actually have more disposable income to spend. Why is the discrepancy there? It's because the policies of the left have been put on the whole country
that have made these blue states so wealthy. These policies of the left.
They're taking the money from the Midwest. As I said, just the mortgage interest deduction alone, it's something that Nancy Pelosi will fight for tooth and nail.
You can use that as a way of indicating housing values, but that's pretty much it. I mean,
it's not the money that's being given to the left?
Well, no. People in Mississippi are not using the mortgage interest deduction as much as somebody in California because people in Mississippi can't afford to buy a house because of Republican, conservative, libertarian economic policies.
Completely not true. Look, if we actually look into the data and we look at it, African Americans have the lowest life expectancy of anybody on that list. So the only thing that the list says, the only thing the numbers say, is that the left, the elite left, and we know that they're the elite left.
What does this have to do with race when the second worst state is West Virginia?
I'm sorry, one outlier to it. But if we look at the numbers, the African Americans have a lower life expectancy than
fifth worst state.
Anybody else.
And to the best of my knowledge, Oklahoma is probably 95% white, probably 98% white.
I actually don't think that number is true, but I'm not going to guess on the numbers here because I looked at the numbers for the research, and the fact is African Americans aren't any better in any of the states.
I get it. There's a Holocaust level crisis with regard to both wealth and lifespan in the African American community, and frankly, it's even worse in the Native American community. And those are true. But that doesn't have anything to do with red state versus blue state policies. Or maybe it does. Actually, it has a lot to do with it because in the red states where they didn't expand Medicaid, so they're saying to somebody who's working 2 jobs or 3 jobs at $7.25 an hour and still can't, still having to eat cat food to survive, particularly if they have a health insurance or health emergency, you're saying to them, tough luck, Charlie.
I'm glad that you brought up Medicaid because it's one of the better places for the numbers on the right here. The only study that's been done on Medicaid is the study that was done out of Oregon. I know that
was a meaningless study.
It was not. 6 months. It was only meaningless because it didn't have the numbers that you support. What that said was it was a randomized study, the only randomized study that's been done on Medicaid, and it said that there was no life expectancy difference, no mortality difference, no health difference in Medicaid.
It was 6 months into the expansion of Medicaid that they did this. A couple of right wingers did this so-called study.
It wasn't right wingers. These were academics from across the country. If you say that's nonsense, then you have to say the same thing about environmental science. This was actual science and a study, and it was a randomized study. So to say it's nonsense is wild.
How can you say, okay, we expanded Medicaid 6 months ago, and now we're saying people aren't living longer? Oh my God, it's a failure.
What I love that there's second and third rounds of this coming out, but what happens is that as you get further out...
Harvard did a study, and they found that 45,000 people a year were dying for lack of access to health insurance, and they're now saying because of the Affordable Care Act, it's down to around 20,000 people a year, and the majority of those are in these very same red states where these libertarian/conservative policies of, no, you can't have health insurance unless you're rich enough to buy it.
A non-randomized, non-scientific study, that's great.
I'm talking about common sense. Isn't it common sense that if people have reasonably priced access to health insurance, that they're going to live longer?
Have access to health insurance? You're saying that if they have access to a piece of paper, that people are going to live longer. No, the answer,
no. Access to money to pay their medical bills.
You actually said health insurance. The fact is
money
what
to
you
pay
need.
Your health
you don't
bills.
need access to a line. Access to a line doesn't give anybody more health. Access to actual health care, medical
Which
care,
you have to pay
gives
for.
people. That if you pull the government out, you have to pay 20% less than when you have the government involved. Where the government's involved,
the Medicare and Medicaid overhead costs are around 2.5% to 3%, not 20%.
They don't. They don't actually.
That's what United Healthcare is making. That's what Aetna's making. That's what Humana is making. They're skimming that off the top and putting it in the pocket of their multimillionaire and billionaire CEOs.
I'll tell you what. We can take a vacation. I don't know what we'll do together while we're on this vacation. Maybe you can. But I'll take you on a tour number of a surgery center while we're on it, and we'll go with one that's free market, where they don't have people that have to file the codes with the federal government and wait 2 or 3 months for reimbursement and not know if they're going to get it. And then I'll walk you through a free market clinic where they have one person doing codes, and that's so that they can help people on unemployment.
They're not taking insurance.
They're not taking insurance. They're not taking Medicare, and they're not taking Medicaid.
So you're making my case. I mean, this is the same thing in Canada. You go into the doctor in Canada. All you have to do, well, it's the same thing with Medicare. I can tell you, I'm on Medicare. I go see the doctor. Here's my number. That's it. I never see a bill. I never see any paperwork. I don't get rejected. I go to an MRI.
That's great. Congratulations on your care. My 5-year-old, 3-year-old, and 1-year-old will be paying for that care for years.
Well, my point is, if Medicare was provided to everybody in the United States, if we simply went to a single-payer system, Medicare for all in the United States, your example of a so-called free market versus so-called government-funded healthcare center, surgery center, just completely blows up in your face, Charles.
No, not only does it not work out, the only thing that a universal Medicare for all does.
A single-payer system where the single payer is the patient. I'm talking about a single-payer system where the single payer is our government.
Yeah. So you want somebody else making your healthcare decisions for you? I want the people making the decisions.
No, the doctors make the decisions with Medicare. I have not had a single government official tell me, and I've been through, in the last year, as you know, because I had this disc that exploded in my back, and I was in insane pain and ended up having surgery. So I've been through neurologists and physiologists and orthopedic surgeons and neurosurgeons, and what a mess. I mean, and never a bill, never a peep. I guarantee you, if this had happened a year ago when I was on, using health insurance, I'd be getting, notices from United Healthcare saying, oh, we're not going to pay this. Oh, we forgot to pay this. We lost the paperwork on this one. I'd be getting Dunning's notices. I'd be getting harassed by bill collectors.
And then you could have actually left them. What happens when the government does it is the government doesn't tell you. It's just the way that the doctors treat it.
They just pay the bills.
They withhold service. They stop giving service.
Nobody has withheld any service from me.
Look at the lines of people in Massachusetts. There's a great little Lego demonstration of this that demonstrates the line length of people waiting for care in Massachusetts. Romney Care, where Obamacare came from. This is what we need to pay attention to. Access to a line is not access to care.
Care everywhere in the United States.
The surgery center I'm going to take you to, we can walk in today and get you surgery on your back, and it'll be done by the best people in Oklahoma.
Right. So, you're making the argument that
you can bring in Bitcoin, you can bring in chickens, you can bring in whatever you want. I can even ask them for a handout. I'll tell you what. I bet he would do it yours for free. Yeah.
You're back to
the way that it used to be, Tom. When
Paul's argument,
when people weren't dying in the streets.
When I was a doctor, they used to pay me with chickens. I'm Ron Paul.
And people weren't dying in the streets. It's amazing.
They absolutely were. This is what Harvard documented. 45,000 Americans a year dying in the streets. Actually, most of them were dying at home, but
And under the government program, and the Oregon study proved that the same amount of people are doing.
Okay, you get the last word. Charles Sauer, hang on just a second.
This is the Thom Hartmann Program.
Charles Sauer's organization, marketinstitute.org. You can tweet him at Charles Sauer, Sauer, or at Market Institute. Thank you, Charles.
Thank you.
We'll be back.